We are back now to dig deeper into Doug Ford's announcement today. A 4-week province-wide emergency break will go into effect this Saturday. It will be descending on Ontario as concerns grow that the variant-driven third wave is deadlier, more contagious, and pushing hospitals past the breaking point.
This is a new pandemic. We're now fighting a new enemy. The new variants are far more dangerous than before.
The emergency break means schools stay open, but all indoor and outdoor dining ends. Grocery stores can open at 50% capacity, big box stores and other retailers at 25%. No gyms, no haircuts, outdoor gatherings limited to 5. It's very similar to what Toronto and Peel have been experiencing since November, although the government had started easing restrictions in those regions despite worsening numbers. We've been slowly watching this unfold with warnings from doctors and the Hospital Association. Why are you only taking this action now?
We thought at the time there was under 1,000 cases, and again, with consultation with our chief medical officer and the local medical officers and all the mayors, every single one of them were saying we needed to open up. And, a lot of people let their guards down.
This morning, the Health Sciences Table released its latest modeling projections with grim numbers. ICU cases are predicted to almost double to 800 cases by the end of April, potentially putting doctors in a situation where they have to decide who gets care and who doesn't. Variants pose double the risk of ending up in ICU.
You will see that COVID is killing faster and younger. It's spreading far more quickly than it was before, and we cannot vaccinate quickly enough to break this third wave.
In one case, Dr. Brown says 3 family members all had to be treated at different hospitals due to capacity issues, and all died. The Health Sciences Table points out failures, concluding vaccinations are not reaching the highest risk communities, and essential workers are bearing the brunt of the pandemic. It calls for a 4-week stay-at-home order, but the government has chosen an emergency break instead.
We are not going to be producing a stay-at-home order because we saw that last time that it had tremendous ill effect on both children and adults.
If the public is confused, it's no wonder. The government has used terms like lockdown, shutdown, gray zones, stay-at-home orders, emergency breaks, each hard to distinguish from the other, and it changes its terms on the fly. This morning, the government had this chart on its website with shutdown as the most stringent restriction. A short time later, it was replaced with emergency break. The Premier insists this is now the right course of action, but he has to convince a weary public.
We have to do it. We have to crunch down one more time for 4 weeks. It's a sacrifice that we have to take.